Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
Right, so Dr. Emefa Dzide has joined us once again this afternoon on the show. Doc, good afternoon.
Good afternoon.
How are you doing today?
By God's grace, as usual.
We bless God. Today, our topic is alcohol-related diseases. And to start it, what are we saying if we say alcohol-related diseases? And are we only talking about the liver problems, or maybe it has other things we need to talk about?
Yes, all right. So it encompasses a lot of different conditions, not just liver conditions.
Okay.
But because the liver processes up to 95% of all alcohol that enters the body, it's more affected by any negative effects of the alcohol. Yes. So generally, the most important, the most common ones are the liver diseases. We have the fatty liver, alcoholic hepatitis, liver cirrhosis, liver cancer. Then we have heart diseases. We have this cardiomyopathy where the muscles become weak and then the heart gets enlarged. And dilated. It can also cause hypertension, stroke, and other rhythm-related disorders. Then the gastrointestinal tract, it can cause malabsorption, so you can't absorb certain nutrients. It causes gastritis and peptic ulcer disease, and can also cause pancreatitis. Yeah, then can also lead to different cancers, especially cancer of the mouth, throat, esophagus, liver, and then sometimes associated with colorectal cancer as well.
Which one is the colorectal cancer?
The intestine,
your colon.
The large intestines.
Okay, all right.
And then it also affects the brain and the nervous system. So sometimes there's impaired judgment, poor memory. It can cause the brain to shrink. It causes dementia. It weakens the nerves. So you can have what we call a neuropathy, where you have this numbness in the fingertips and the feet. And then we have this severe form of mental, should I say, memory disorder.
Okay.
It's caused by thiamine deficiency. And then we also have other mental disorders like depression, anxiety, which can be precipitated by alcohol use, and then alcohol addiction, as we know as is common. And also the immune system can also be suppressed by intake of alcohol, and then can lead to infections and other things. The endocrine system, the hormonal disorders can also be caused by the alcohol. Diabetes, sexual dysfunction is also a very important thing that's affected, and then sometimes the bone health as well. And with the skin and appearance, you might have premature aging, spider veins on the body, facial flashes. So like you have in Africans, you see it as a darkening of the skin of the face.
Of the face.
Yes, and then poor wound healing. So it's actually a whole lot of things that can happen to you if you, should I say, misuse alcohol.
Okay. Now, what is the difference between someone who drinks regularly and someone who has developed an alcohol-related health problem?
Okay. So there should be a distinction between the health problem and just the normal social drinking. So if you are drinking and it doesn't affect your daily responsibilities, you can stop whenever you want. You don't have any withdrawal symptoms if you stop taking the alcohol. Yes, and then when you take it, it's, let's say, enhances social situations, makes you more comfortable, that's fine. And then if you are consuming within the recommended guidelines. But if you are having a problem with alcohol use, you might always be exceeding whatever you plan to. You say, oh, today I'll drink only one bottle. Then you realize you drank
2 or 3,
4 bottles and all those things. You are having difficulty controlling yourself, and or maybe there's a pattern of binge drinking. If you are drinking, unless you drink 10 bottles at a time. Yeah. And then if you have dependence, when you realize that your body is not able to function normally without the alcohol. Yes. And then when you are not able to control yourself when on alcohol. So the alcohol actually makes social situations awkward and rather difficult. Yes. Or you feel out of control in the social situations. Yes. So that's when you can determine that this alcohol use is actually a problem and it's not just social drinking. So it does not necessarily depend on the quantity per se. Although the consumption guidelines, we recommend For women, 7 units a week, and for men, 14 units a week. Yes, so in that case, you're not supposed to drink all the units in one day.
Sure.
That's wrong. So you can say 1 unit a day for women, 2 units
for
a
the
day
men.
for men. Yes, that's the safe one. So 1 unit is like the small bottle of beer, not the full big bottle. The small
one.
That's 1 unit. The big bottle of beer is actually 2 units.
Okay.
So, or 1 unit is like a small glass of wine, about 125 mils.
Oh wow.
Then hard liquor up to 40% is like 1 tot, about 25 mils.
Okay.
If you're drinking anything harder than that, probably about 10 mils of that is equal to 1 unit.
Okay. Wow. Then we're really abusing that. Okay. Now, is liver damage reversible?
Yes and no, depending on the level of damage.
Okay.
Yes. So there are stages of liver damage as you are taking in a lot of alcohol. So we have what we call the fatty liver disease. That one is actually very reversible. Once you stop taking the alcohol, within some few months, you should get the liver back to normal function. Alcoholic hepatitis, that's a step above the fatty liver. That one, you may get things back to normal, you may not. Yeah. And then when there is fibrosis, that's scarring of the lung tissue, depending on the amount of or the percentage of lung liver tissue that is scarred and non-functional, you can reverse the damage.
Okay.
Yeah, so you can reverse the scar tissue that has formed, but you can reverse, let's say, the ability of the liver to function.
Okay.
Yes. But when there's cirrhosis, that means there's too much scar tissue, and that one is irreversible. It leads to liver failure. You need a transplant for that.
Wow. What symptoms should prompt someone to see their doctor because they might have developed alcohol-related health conditions?
Okay, so I'll start with the very serious and emergency room visit. That if this happens, go to hospital immediately. Yes. Vomiting blood or vomiting something that is brownish, like coffee grounds and all that. That's altered blood. Yes, so that means you are bleeding. The bleeding could be from a blood vessel coming from the around the liver side, or it could be from stomach ulcer, from the peptic ulcer. So either ways, you need to get to the hospital as soon as possible. Yes. If you're having severe abdominal pain, that could be an acute pancreatitis, or it could be a perforation from the peptic ulcer. So you have to get to hospital immediately. If there's confusion and altered mental states, that means probably there's an encephalopathy, something going on wrong with the brain. If there's difficulty in breathing, this usually happens when they end up in heart failure. Yes, so you have to get to the hospital. Chest pain as well. And then if you're having signs of withdrawal, so you decided to stop taking alcohol on your own, and after 24 hours, you're having tremors, sweating, having hallucinations, get to the hospital immediately. So those are the serious signs that you need to go. There are other things. So as I mentioned, the different organ systems. So the liver, if you're having pain in the right upper quarter of the abdomen, or you're having a swollen abdomen, or dark urine, pale stools, you have to go to the hospital. It's not an emergency, but you the next morning go. Yes. And then cardiovascular diseases, if maybe you're having chest pain, shortness of breath, you are getting tired very easily, there's swelling of your feet, or you feel the heart is beating very, very fast and all that, yeah. And then as I mentioned, the signs of the withdrawal symptoms to the tremors, numbness, confusion and all that. And then if there's digestive problems, especially if there's blood in your stool as well, or vomiting and abdominal pains, yes, you get to the hospital. When it comes to the signs of addiction, yes, so if maybe always you are drinking more than you intend to drink, you've tried to stop but you feel that you can't stop, you spend so much time of the day obtaining alcohol, you drinking the alcohol and then recovering from the alcohol. So it's like every day, most parts of your day is either looking for alcohol to drink or recovering from getting drunk. Yes, that's showing signs of addiction. You neglect responsibilities, you don't go to work, you don't do what you're supposed to do at home because you're always drinking. That's also a sign. And then you realize all these problems because of the alcohol, but you still continue
drinking
in spite of all the problems that you are seeing, then you know that that is a serious sign. So you have at least 2 of these signs, you know that you have an addiction problem and you need to get help. Other medical stuff, you can have high blood pressure, sleep disturbances, frequent infections, memory problems, vitamin deficiencies, and those things. So those are things you might not really take note of, or you might not take too seriously, but those are also signs that your alcohol consumption is actually a problem to your body.
What treatment options are available for people who have developed alcohol-related diseases, and how much recovery is possible if someone stops drinking?
Okay, so I've already mentioned the liver, what is reversible with the liver. So yes, so fatty liver is reversible. Alcoholic hepatitis, not so much. So depending on which organ system is affected and what exactly the damage is, we treat as such. So the alcoholic hepatitis, we give some steroid and then supportive treatment and all that. When it comes to cirrhosis end stage, that one, your only option is the liver transplantation, or you go for palliative care. Yes. So cardiovascular diseases, the standard maybe antihypertensive medications for heart failure, and then to manage the rhythm of the heart. Yes. The brain issues, usually most of the time, is from the vitamin B deficiencies and folate deficiencies. So probably you have to supplement that, and then, but usually the brain and the nervous damage, it's like a 50-50 chance of recovery. Yes, so we can't be too sure about it. Yes, wow. Yeah. So and also other factors that also like determine these things, if it's reversible, it depends on how severe the alcohol use was, like how the quantities you were drinking and how many years you have been drinking at that rate for. Sometimes it depends on the extent of the organ damage. It depends also on the age of the person and the person's overall health. Sometimes they don't eat very well. Yes, and then that could lead to more problems. And then also, if they are adherent to treatments that are being given. Sometimes you admit a person and he will run away from admission because he's going to look for drink.
He has to.
Yes, so it depends on a lot of things. But basically, if it gets too severe, it's probably not reversible.
Wow. To wrap up, there is a myth that if you stop taking alcohol immediately, it can lead to some health implications and all that. If someone has been drinking heavily for years but wants to stop, are there medical risk of quitting suddenly?
There is. It's not a myth. It's actually a fact.
Wow.
Yes. So if you have what we call withdrawal from the alcohol, that can lead to a very life-threatening condition. Situation. It's called alcohol withdrawal syndrome. It's actually, let me just explain a bit what the alcohol does. So alcohol is a depressant. So it depresses your brain and the nervous system. So it's like maybe you are used to trying to fight, and then there's always someone holding you down. So the alcohol is like holding you down. You're not able to fight. So the moment the person lets go,
it starts
the same
becoming,
energy you are using. So that's what happens to the brain and then the nervous cells. So because they've been depressed so much by the alcohol, the moment the alcohol leaves the system, then they begin to get too excited and then they fire excessively. Yes. So then you have the withdrawal symptoms, you have the tremors, and then so as the timeline goes on, so within the first 6 to 12 hours, there'll be tremors, sweating, anxiety, nausea. From 12 to 24 hours, then they start having hallucinations. They'll start saying there's something moving on my body and those kind of things. 48 hours to 72 hours, then that's the peak time. They start having seizures. So sometimes they can even have the seizures continuously back to back to back until it kills them. Yeah, so it's actually a very severe condition.
Situation.
So it has to do also with the severity of the alcohol use as well. So once you want to get off, especially if maybe you've tried to get off before and you weren't able to, or you tried and then you started having some tremors and all those things, yes, or you have some other medical conditions, maybe you already have hypertension, or you already have some diseases as a result of the alcohol use, you have to come to the hospital for medical supervision in order to go through what we call the detoxification, the medical detoxification. Yes, so you need to be at least on admission for the first 72 hours. And then we monitor you closely. So as and when these things are happening,
we can
give you medications to sort it out. But some people who are not, they don't have the withdrawal symptoms. It's not so severe when they are getting off the alcohol. So it actually depends on the individuals. But as I mentioned, if you have those specific things that you've tried before and you realize the symptoms, or you are already having a medical condition, diabetes or something, you have to do it under medical supervision.
Wow. Unfortunately, this is where time will permit us. I have a lot of questions even, but then this is where time will permit us. But then we are very grateful for your time this afternoon. And if you're out there listening to us, please, this is your chance. That was Hello Doc with Dr Emefa Dzide. Remember,